Now I'm pleased to yield 4 minutes to another new member of the House Rules Committee, Mr. Massie of Kentucky, to speak on the rule.
You're recognized.
Thank you very much. I rise in support of this resolution because it would facilitate the passage of H.R. 497, the Freedom for Healthcare Workers Act. What does that bill do? It ends the unscientific, illogical, immoral, unconstitutional, unethical vaccine mandate on healthcare workers that is predicated on lies. What are some of those lies? Let's start with the first one. The first lie, the vaccine prevents spread. Who says that it doesn't prevent spread? Is this an internet conspiracy? Well, it's on the internet, but it's the CDC director, Rochelle Walensky, who said a year ago, what the vaccines can't do anymore is prevent transmission. Pfizer admitted they were not asked by regulators to assess whether their shots reduce transmission, nor did their trials measure whether the shots reduce transmission. What's the second lie that this mandate is predicated on? The vaccines don't cause any harm, can't cause any harm. They're safe. They're completely safe. You have nothing to worry about, no side effects, no adverse reactions. Who disputes that? Is it an internet conspiracy? It's the CDC website. Yes, it's on the internet. The CDC website acknowledges that the vaccines can cause myocarditis, pericarditis, blood clots, and even death. CDC and FDA recently announced they had identified a preliminary vaccine safety signal for persons 65 and older for the bivalent vaccine, that it could increase their chance of stroke in the 21 days following vaccination with Pfizer's new bivalent vaccine. What's the third lie that this is predicated on, this vaccine mandate for healthcare workers? That it's scientific, that it makes sense. How does it make sense to require somebody to have 2 shots targeted at a variant of the virus that is no longer circulating? To have 2 shots that wear off after 8 months, 2 shots that were taken 2 years ago. The CDC acknowledges that those vaccines that are mandated, taken 2 years ago, have worn off by now. Why would you mandate them? What's the fourth lie that this vaccine mandate is predicated on? It ignores natural immunity. When the vaccines first came out, the CDC that said that the Pfizer trial showed that the vaccine was 92% efficacious for those who had already had COVID. Guess what? It showed no such thing. I called the CDC. They admitted to me it was wrong. They said they would fix the website. Here we are, over 2 years later. They haven't fixed that lie on their website. They know it's a lie. I have them on a recording if anybody over there wants to hear it. Finally, who's liable for the damage that this could cause? Nobody's liable. We're living under medical malpractice martial law right now under the PrEP Act and the EUAs. Let me close with this. This vaccine mandate affects nurses. 85% of nurses are female. And this Joe Biden's COVID vax mandate for healthcare workers has forced many from the workplace. Many of them quit nursing as a career, retired early, or didn't pursue it as a degree. This is the epitome of hypocrisy. Nobody in this room was mandated to take a vaccine. And we're voting on whether we're going to force people who want to take care of people, whether they have to take the vaccine. In the hypocrisy, none of us were mandated. None of the staff in this room were mandated to take this vaccine.
Expired.
End it now. Support this rule.
Gentleman from Texas reserves. The gentleman from Massachusetts.